How to keep C-section incision dry when overweight. One of the necessities following childbirth is to keep the C-section area dry most of the time. However, there are situations when maintaining dryness is difficult. For instance, moisture and sweat buildup are unavoidable when skin hangs loosely. It may increase the chance of a yeast infection near the C-section incision. Additionally, it will result in a wound that heals more slowly than it should. Perhaps you are organizing your C-section, or perhaps an emergency C-section left you with little time for planning. This article is brimming with advice on how to keep an overweight C-section incision dry. What is a cesarean section? C-section is another name for a cesarean section. When a vaginal birth is risky, or the expectant mother requests it, this surgical procedure is utilized to deliver the baby. An incision is created across the lower abdomen during C-sections. The length of the incision is typically between 10 and 20 centimeters. Although the incision is typically done horizontally, it can occasionally be made vertically. If you're obese and have been chosen for a C-section delivery, you might be concerned about how it will go. C-section recovery for overweight women. Every woman's delivery of a child is reportedly different. The safest method of bringing your child into the world is a C-section. In addition, unlike what some people may think, it does not diminish your role as a mother. Mothers who are overweight are more likely to undergo a C-section birth, particularly if they experience any major difficulties. The infant in this group of mothers is frequently too big for vaginal birth. Additionally, they are more likely to have labor induction, making the C-section the literal easy way out. How to keep C-section incision dry when overweight. All body types undergo surgery and give birth to children by C-section. They need to be handled carefully, even though they are typically thought of as being safe. It takes a bit more effort to keep the incision dry when you are overweight, but there are several techniques to keep the incision region dry so that the wound heals properly and your apron belly won't aggravate things. Hair dryer on cold setting. If you live in a humid or wet environment or have difficulties drying off completely after a shower, try this approach. Just grab your hair dryer and switch it to the lowest, coolest setting. Lift the skin that is hanging over your C-section scar or your mother's apron, and blow dry it thoroughly. One of the more useful suggestions for this blow dryer hack is to ask a family member or your spouse for assistance. It can be difficult to keep everything in place, see what you're doing, and use the hair dryer all at once. Use sanitary napkin as a wound dressing. Place the soft side of a sanitary pad against the cesarean section site and glue the sticky part of the pad to the inside of your underwear to prevent excessive fluid from seeping into your incision. Make careful to frequently replace your pads to avoid getting sick. Wear loose-fitting clothing when possible. After cesarean sections, most women find it more pleasant to wear loose-fitting clothing to prevent rubbing or friction on the wound. It also helps in pain relief. You can wear nightgowns, house dresses, or even your husband's sweatpants. If it's summer, a flowing sundress or a loose-fitting top paired with baggy jeans is a great option. Postpartum recovery from C-section. In order to reach your baby, your C-section requires cutting through the uterus and abdominal wall. Your baby was then retrieved through this incision site. The incision site of a C-section is normally sewn shut, leaving a scar that will take some time to heal. There will still be vaginal bleeding, just like when a woman gives birth vaginally. Postpartum recovery following a C-section includes care such as obtaining enough sleep and receiving a fundal massage to help the uterus return to its pre-pregnancy size. Tips for C-section recovery. Prior to anything else, it's critical to understand that healing from a C-section is not simple. You have to care for your new kid as well when you're still recovering from your recent operation, especially if you're breastfeeding him exclusively. If you also have other children to care for, the challenge is exacerbated. You should therefore seek out as much assistance as you can. Even though you'll probably stay in the hospital for 2 to 4 days following surgery, it will take weeks for you to fully recuperate. Throughout this new phase of your life, you must be kind and patient with yourself. Here are some of our recommendations for speeding up your recovery from a C-section. Don't be afraid to ask for help. You won't be able to accomplish much after your C-section. You'll need all the help you can get to take care of your home, including cooking, cleaning, and dishwashing. This is due to the fact that you need to pay attention to both your quick recovery and the duty of caring for a newborn. Hire a support person to help you at home if your budget allows it. You don't need to strain yourself further by having people over to see your newborn. They'll be able to appreciate that you're using this time to get as much rest as you can. Treatment of pain. You'll experience severe pain. You recently underwent a major operation, so that's all right. You can take over-the-counter pain relievers like ibuprofen to help you manage the pain. To prevent constipation, your doctor may advise you to take painkillers and perhaps a stool softener. A heating pad or an ice pack can also be useful for pain relief. Take a walk. It can be difficult right now to get up and exercise, but push yourself to go for a stroll. This will hasten the healing process and may even aid in avoiding issues like blood clots. You don't have to go very far or very long. It's crucial to begin slowly and raise your activity level gradually. In 6 weeks, you'll probably be able to begin the moderate activity. However, it's advisable to wait until your doctor gives you the all-clear on when to begin. Drink a lot of water. You should consume a lot of fluids in addition to a stool softener to prevent constipation. Because of all the medications you're on, this is to be expected. To keep your bowels from being overworked, you must try your best to avoid becoming constipated. Drink considerably more water if you're pumping or nursing in order to maintain a steady milk supply. Utilize a stomach binder. An abdominal binder might be quite useful if you need to perform physical labor or housework. It will lessen your post-C-section discomfort and give you the impression that your body is still intact. Just keep in mind to adhere to advice on how to keep a C-section incision dry while overweight prior to using an abdominal binder to prevent infection. Cleaning the C-section wound. You may be able to quickly shower 2 days after your C-section. To stop infection, it will clean your wound and you. Another crucial step to lowering stress and calming your nerves is taking a brief shower. But remember, just a quick shower, not a long soak in the tub. To clean the wound, lightly run water over it. Although you shouldn't rub antibacterial soap into the wound, you can use it around the incision. You can start cleaning it with warm, soapy water after 4 to 5 days. Take these easy steps to care for your C-section wounds. 1. Take off the wound dressing before taking a quick shower. 2. Eventually, cleanse the wound every day with warm, soapy water. 3. After bathing, properly dry the C-section wound with sterile gauze or towel. 4. To dry the wound, use a hairdryer in a low, cool setting. C-section scar healing stages. The recovery from your C-section typically occurs in 3 stages. Understanding these phases is crucial so that you are prepared. Understanding the ideal appearance and sensation for your incision area as it heals is equally as vital as knowing how to keep a C-section wound dry when overweight. Inflammatory stage. As your body heals, this is probably when things seem the worst. This phase follows a C-section and usually lasts about a week. During this time, you may experience things like the discomfort that worsens with physical activity and a greater need for an ice pack or pain medicine. Proliferative stage. The healing ramps up during this period, which typically lasts 3 to 4 weeks. Blood vessel formation starts to increase, and more blood vessels equal more tissue. Additionally, Collagen accumulates there to begin fusing the borders of the skin back together. Even though you might not always feel comfortable, you should make sure you are moving about a lot during this period. Walking can assist in preventing blood clots from developing, which can cause fatal problems. Warning signs of C-section infection. It's likely that you will experience pain while performing a few chores after a C-section. Women are generally advised to take it easy and unwind. This can entail staying in bed longer, making sure you get adequate sleep, and drinking lots of water. Everyone's healing process is unique, so take your time, you will fully recover. Pain, redness, and swelling. Mild discomfort, redness, swelling, and sometimes even a little leaking is common. But if your discomfort keeps getting worse, it can be an infection. Due to the difficulty in maintaining the incision's dryness, obese women are more prone to develop a wound infection. After giving delivery, some vaginal bleeding is typical. Call your doctor right away if you are concerned about excessive bleeding. They'll be able to offer you the best guidance. Monitoring the C-section wound. You'll receive more advice on how to avoid infection and what to watch out for before you leave the hospital. Additionally, the significance of monitoring wound complications will be stressed to you. An infection may be present if your wound changes significantly. Ask your partner, a member of your family, or a friend to look for the wound if you are unable to notice it yourself. They will be able to reassure you or provide you with advice. Final thoughts. In this article, we have discussed C-section incision and C-section incision dry when overweight. Do give this article a read before your major surgery to stay away from extreme pain and practical tips to avoid serious complications. If you like this video, make sure to give it a thumbs up and also subscribe to my channel for more informative videos like this one.